Good morning. Let me just change my AirPod. I'm sorry. Okay. Good morning again. Hope there is no technical problem. Let me check. Doing a little sound check. Check. Sound check. Yes, you can hear it. Okay, and Linda is also telling me the sound is good, so we can go ahead and start today. Okay, today is Saturday, March 11th, 2023. This is our regular scheduled yoga therapy class, and as we always told you, that we are presenting all of our experiences. We have been presenting yoga therapy for different clinical conditions for a long period of time, and this class is nothing but sharing our experiences. So last Saturday we talked about yoga therapy for metabolic syndrome, and metabolic syndrome may be a new term to many of you, but it is nothing but what we heard about the risk factors for heart disease, risk factors for diabetes, risk factors for hypertension, but there is nothing called risk factors. They all are included in under one umbrella called one syndrome called metabolic syndrome, and this is the outcome of the stressful life we are maintaining today. And I explained everything to you during my last presentation, and today we'll do a little bit more practices and show you what else you can do for metabolic syndrome. Now, just going briefly over it, stress affects our emotional brain, which we call a limbic system. There are two nuclei called amygdala and hippocampus. Amygdala responds to fear, hippocampus to your memory, and it sends a signal to your hypothalamus through neurotransmitters. Hypothalamus sends a signal to the autonomic nervous system and the pituitary gland called pituitary adrenal axis, and there is an altered hormonal homeostasis. Hormones are abnormal, and also there is a sympathetic overdrive. Sympathetic tone gets very overdriven, and creating first the hormone of stress is called cortisol, which converts our sugar, which is the end product of metabolism, to a fat called omental fat, which is called a truncal obesity. This is all sitting here. The omental fat is intra-abdominal, is inside the abdomen, and omental fat is almost like an endocrine organ. It secretes adiponectin and your pro-inflammatory molecules. and the inflammation is the root cause for your diabetes, hypertension, atherosclerotic heart disease, or what you call a coronary artery disease, or also called a blockage in the blood vessels of the heart, and dyslipidemia. Dyslipidemia means a high cholesterol or a combination of high triglyceride and low HDL. HDL is your high density lipoprotein, which is a good cholesterol. So the whole concept is, what yoga says, that I am the cause and I am the cure. What does it mean? All of these diseases, what is killing us today, the number one cause of our death and our chronic sufferings, chronic diseases, are these collection of the diseases which is called metabolic syndrome. Now these are called endogenous disease. Endogenous disease means it came from inside, not the outside. Disease coming from outside called an exogenous disease, coming from outside. Like say, for example, infectious diseases, or even simple today like a COVID-19, or the allergies. But when it comes from the inside, that means I am the cause of the disease and I am the manufacturers of this disease. So if I have a problem, where do I go? I go to the manufacturer. So where do I go? Manufacturer is in the limbic system, or called emotional area of your brain, which is being taken care of by relaxation response and balancing both sides of your brain, and also activation of parasympathetic tone. Now, if you cannot get the manufacturers, or if you cannot get into the manufacturers, you can go to the local mechanic. Local mechanic can fix you temporarily, but local mechanic probably is not able to do what manufacturers are able to do. So who are the local mechanics? Local mechanics is our local doctors, our local hospitals, your pharmaceutical support, and whatever we are doing that's called a band-aid for our metabolic syndrome. But primary therapy is to access that manufacturer. That is me. That is me, and I have to correct that myself. So we talked about last time that to counteract that sympathetic overdrive, what are the steps we are doing? We are doing relaxation response of physical body. We went through all the asanas and the main pranayama, which really we call it a metabolic pranayama, or we call it a Agni Pradhan pranayama. Agni Pradhan pranayama means it ignites our Agni, the digestive fire. Because according to yoga, that if your gut health, that means the food you are eating, get properly digested and converts into 7 tissues which you are made of, then finally converts into ojas, which is our immunity, we are slowly accessing or slowly getting in touch with our manufacturers and trying to control the metabolic syndrome. Before we start, the one question I got, which is extremely important, the question was asked, how often do I need to do all these practices to get effect in my metabolic syndrome? Our experience is, if you do any yoga practice, especially with us, like when you're doing in person before pandemic, we generally used to do 1.5 to 2 hours, primary relaxation response and a pranayama practice and meditation. And for us, for you to recommend for a daily practice, 1 hour, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. You are going to have a immediate or instant result. We do all of our practices with our health tracker. I put an Apple Watch, or you can use a Fitbit or any kind of, and you can take a look. I used to get a text messages, in my class, oh, my blood sugar never came down to less than 140, 150. I was in your class, I went home, my blood sugar is now about 90. I am doing this relaxation response, my heart rate is coming down, my blood pressure is coming down, I feel a sense of calmness, I feel a parasympathetic activation, calm and digest. I feel that I have a strong digestion, easy elimination, good night's sleep, the sign of health. So, we get an immediate result of yoga practice. So, when you look at the literature will say, yes, we took this many people, this many patients, we did a randomized control study, we did this portion, this test, this practices for 2 weeks, 4 weeks, 6 weeks, and we got this result. We got a double-blinded study, we did a control group, we did a yoga group with this study. But unfortunately, it is not long-lasting and sustainable. The moment you stop it, it comes back. So, our experience is the art of transformation, transforming a disease-ridden person with all the metabolic syndrome, including truncal obesity, diabetes, hypertension, heart disease. What you do, you take a medication every day, so you have to continue this every single day. And according to yoga and Ayurveda, this is your called daily routine, dinacharya. If you follow the daily routine, which I have multiple videos, you can go to my YouTube channel, you can have the daily yoga practices. In fact, I have a DVD called Yoga Therapy for Health and Healing, and it's called a daily practice. The moment you do a daily practice, here it is, that you can see Yoga Therapy for Health and Healing, a daily practice. Now, what the daily practice is going to do, it is going to transform you. In Sanskrit, we call it rogi. Rogi means people with disease. To a nirogi. Nirogi means people have no disease, people who is healthy. Then transform into a yogi, or we call it yogini. Either yogi or yogini, we will get a disease-free, medication-free, and enjoying a good quality life. Okay, so we're going to start practice. Let me get the health tracker. Sorry, I forgot to get it, but I'll get the health tracker and practicing all the health parameters. So last time we did a practice for a relaxation response and your so here I am. I have my Apple Watch which connects with my iPhone. So all the information from here goes and stores in my iPhone. The most important practices after relaxation response and activation of parasympathetic tone is your balancing practice. So what we teach the people about balancing practice is that you start with a balancing both sides of your brain. So how do you do balancing both sides of the brain? First, you get into what we call going against the grain of your habit. What is meant by going against the grain of your habit means we are lateralized. I am right-handed or I am left-handed, that I've been using all my life. Now what I need to do, I need to use my non-dominant side more and more to activate the opposite side of my brain. I'm right-handed, right-footed, so primarily I'll be doing all my activities with my left hand. I brush my teeth, I shave, I use an electric shaver, I've been washing my hand, and my hand, I feel comfortable now with my left hand. So on the yoga practice, what we do, first I'm comfortable standing with my feet a little separated, along the line of my shoulder. And practice if I can put my feet together. Once I put my feet together, next thing I do, I want to do a little standing on one foot. That is the beginning of your balancing practice. And this practice is for mostly people of young people like us. We never get old. We can get mature, maybe senior. So what do we start first? When you're first, you may be able to have a little problem in balancing. You can use a chair, you can be behind chair on the side. So your first practice will be, I'm right-footed, right-handed. See if I can stand on my left foot. So I'm standing on my left foot as long as I can. And my eyes are open and I count 10 seconds, 20 seconds, 30 seconds. If I cannot do it without it, I can always put my hand in my chair. And you start where you are. If you're 2 seconds, 4 seconds, please start. Because the neuroplasticity will set in, you'll be able to do more and more. And once you can do this, then generally, what personally in our practice is, we also incorporate relaxation response with a prayer pose to the back. It's called Paschim Namaskar. We'll put our hand to the back as a prayer pose. Or also we can do what is called a Paschim Baddha Hasta Asana, like holding the hands together. I will hold my left arm with my right hand and put the hand on the top and hold my right arm with my left hand. It creates the same relaxation. Next, I'm going to stand on my left foot, and after a certain time, see if I can do it with my eyes closed. When you do the eyes closed, initially it becomes almost impossible, but when you are able to do with your eyes closed and stand on one foot, we have seen the parameters. And we also mentioned that this balancing pose, combining with the sit-rise test daily, able to get up without a support, is the fundamental improvement with your health to prevent a metabolic syndrome. It won't come to you because you are the manufacturer. You have created this disease. So again, I'm putting my hands, Paschimbaddha Hastasana, on my left foot, my eyes closed, and see how long I can stay. Longer you can stay, better and better your health is, and controlling. It is very difficult, and I practice every single day. Still, you try it with me. Balancing, we'll do the same thing. Now I'm going to do standing on my right foot. Again, for me, right foot looks a little easier than my left foot because I've been using my right foot all my life. So after a while, I'll close my eyes if I can stay on if I can stand on my right foot with my eyes closed. But for your protection, either you can put a chair in front of you, sit behind the chair, or keep it on the side, or maybe you stay against a wall to prevent any fall. We don't recommend you to do a pranayama standing up because pranayama causes an altered sense of consciousness. But when you are able to do it with effortless ease, that means that is your normal breathing, a very relaxation response called a breath of fire or Kapalbhati pranayama. Now you will see in the balancing pose, slowly and slowly get into the steps. First, you try slowly your tree pose. You might hold your feet, bring it up slowly, as high as possible, and then once it comes to a proper position, see if you can stand, and see how long you can stand longer and longer. This is a little higher up than a normal. Tree pose. Next you do, you can get into a tree pose called the Brikashana, and you can put your hands in front. You can put your hands in the top, but also try putting your hands to the back, like a Paschim Namaskar. You will see the difference in a Paschim Namaskar, in a Brikashan. Then to bring more relaxation response, you will be able to do a Kapalbhati pranayam on this asana, like this. to the opposite side. A balancing pose, you will see, you will start losing your balance. And let me tell you what happens. When you start losing your balance, when you become mature, become senior, number one cause of death for the senior people is a fall with a broken bone, especially breaking the neck of the femur or the hip joint, and also pelvic fracture. And a senior developing that after a fall, it is the end of their life. So you do the opposite side. I'm standing on my left foot. I'm bringing my foot high up and trying to stay here in the tree pose, precaution. And in a precaution, if you've been holding it here, you can see if you can do a relaxation. Yeah, if you're doing it with me, try this. Try this and you will see. The outcome will be totally obvious. Obvious here on your tracker, obvious in your body and mind, and obvious in your day-to-day practice. If you continue a daily practice, which is called a dinacharya, daily routine, wake up in the morning, sit down in a malasana, which is called your squatting pose, drink glasses of water, start the gastrocolic reflex, have a bowel movement first, brush your teeth, scrape your tongue, do the jal neti, washing your nose. Then do a 1 hour practice, 25 minutes of asanas, 25 minutes of pranayamas, and 10 minutes of meditation. So you are doing an opposite side, tree pose, standing on the left foot, I can tell you one thing, once you are getting into the little bit of advanced age, as I said, we don't get old anymore, middle advanced age, you definitely will be losing some of your balances. Even personally myself, I've been practicing it daily. I still can feel now that I'm losing a little bit of my balances, but practice every day. People also have a fear of fall because of the loss of balance. So, see, when they see that people will be walking like this, they'll be walking like this. You know, it is not their posture and their walk, is a fear of fall. Other thing that happens for us is called peripheral neuropathy. Like on our feet, underneath our feet, we lose our sensation. So if you don't feel while we are putting our feet, you will be feeling that a fall, sense of fall. So at home, we generally practice on a bare foot. This is a bare foot. Also, we recommend yoga practice in a bare foot and touching the ground with the bare foot. Always with that. At outside, when we have a choice, I use the yoga shoes, yoga socks, like all the 5 toes are all separated. And you feel like you are walking on that. barefoot. Next, you do, after balancing, that if you put your posture, generally we recommend you to get up in the morning after your proper bowel movement, before you start your practice. Just go back against the wall. Put your ankle against the wall, touch your hip, your shoulder, and your head, and stay in this posture. Close your eyes, breathe out longer than breathing in. Stay in this posture between 5 to 10 breaths, completely effortlessly. Then slowly raise your hand all the way high up. Again, stay here for 5 to 10 breaths. Clasp your hand, put your hand in the top of your head, and also stay here between 5 to 10 breaths. Then you see if you can able to sit down in a squatting pose. In a squatting pose, what you will be able to do that you are sitting in a squatting pose, your ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed. Then your hands will relax, the fingers are all separated. The hands are relaxed, your fingers will go, your hands will turn around. And this is always done with a mudra called an Adhi mudra or a Balo Mushti mudra. Baby fist. Put your thumb inside and close. That's where baby closes their fist. Hand get relaxed like this. Wrist gets relaxed with the extension. Put your one elbow in, other elbow in. Keep your spine straight. Close your eyes. Breathing out longer than breathing in. Exhalation is parasympathetic, inhalation is sympathetic. From here, you'll be able to get up without a support and able to get down without a support. Continue every single day as long as you can. People ask me, how long you do yoga? You do yoga 24/7. You are sleeping. When you practice longer exhalation than inhalation, you'll be doing same thing when you are even sleeping. So, getting up, coming down. If you want to go a little farther, you can go all the way down, sitting on the ground. It's a wonderful practice. See if you can do it. If I always need to get up with the 2 feet, not with the 4 hands and feet. So here I am cross sitting here. From here, I will be able to get up without a support. And come down and sit down without a support. If you put your one hand, you lose 25% of your health. 2 hands, you lose 50%. If you have 2 hands and feet, you lose 75%. You can cross over to the opposite side. Always cross over for your balancing. Relaxation response, activation of parasympathetic tone, and the balancing, activating both sides of your brain. Now we are opposite side, and from here you will get up without a support. Once you're able to do it, next thing you will do, you will be practicing all of your asana practices, which are a balancing asanas. So what is meant by balancing asanas? You have seen, you have done it, say for example, I am sitting here, which is called an easy pose, cross-legged. I'll put both the feet under my knees. Keep my spine straight. Touch my index finger and thumb. Close my eyes. Slowly breathe out longer than breathing in. And my body posture will come in like this. Starting, no pain. No pain and effortless breathing. Remember, in the yogic concept, your lung and heart is the same organ. If you create an imbalance in your physical body, first it affects your heart. Actually, it doesn't matter what happens to your body. Your pressure in the eye may go higher, pressure in the brain may go higher. Anything happens, it essentially affects your heart. The moment your heart has a stress or cardiac stress, it reflects in your breath. You cannot breathe properly. What is effortless breathing? Able to talk, able to sing. Now, once you are in a pain-free, effortless breathing, you change your foot. See if you can do the opposite side, same asana. To feel a little uncomfortable, to Vronasana. Then you progress. See if we progress slowly, how we can balance and activate both sides of our brain. Next one is Siddhasana. Take your left heel all the way to the back, to your perineum. Put the other foot and slowly will come down. If you cannot do it, even the feet is high up here, stay here. Don't push it down. Push it down, it'll come back high up. Close your eyes, do the breathing, start the neuroplasticity. Slowly and slowly this thing will happen. It happened to all of us, it will happen to you also. Same way, this way. It was my left heel, which first time, there's a right heel. Foot, Siddhasana, perfect pose. So how easily we are getting into the balancing asanas, balancing both sides of the brain. Left foot goes high up. Half lotus, Ardha Padmasana, or swastika asana. Again, no pain. Effortless breathing. What is effortless breathing? What I'm doing now, I'm talking to you. I'm even singing. I'm enjoying it. Sthiram Sukham Asana. Sthiram, stillness. Sukham, happy. Asana, pose. So once I'm comfortable, again, to the opposite side. You will have a sensation of this comfort in the asana pose. Initially, people will look at you, you may think, oh my God, look at that, how the person can even sit like this. Eventually you'll find this is the most relaxing experience of your life. Finally, then put other foot height up. You can sit down in a lotus pose. So what it was, left foot high up, the right foot, I've been activating both sides of the brain. So how to do it now? Even in this lotus pose, now I can go back. Last time was right foot was up first, I put the left foot first. And go to the game, the stages. Neuroplasticity will set in. Once the neuroplasticity sets in, you can go back, take your other foot, put it up, and you can get into a lotus pose of the opposite side. It's a wonderful experience. If you keep on doing it, you will see what relaxation response sets in, then you will be able to see all of them in your health parameter, including your blood sugar. And when you go really way, experimental, you can even check your immune response, called IL-6, interleukin-6, you measure the interleukin-6. You can do all the immune response because once you have the food converted into your 7 tissues, saptodhatu, rashadhatu, raktadhatu, mamshadhatu, medadhatu, ostidhatu, majjadhatu, shukradhatu, 7 tissues, then you form into your ojas, which ojas are immunity. Put your foot in the front, very relaxing asanas. Separate your toes, separate your feet, rotate your feet. Once you relax, your whole thighs will all get relaxed. Then you can do it stages your Gomukhasana, cow face. So you take one foot here in this position, taking my left foot in the back, right foot on the top, right knee on the top, sitting in. This is called your Vaisasana. Vaisa is like a buffalo. If you look at a cow, look at a buffalo, they'll sit down, crossing their Vaisasana. Then we incorporate your arms, it will be go to Gomukhasana. And this also looks like a Gomukhasana because metaphorically this looks like a face of a cow. Before we do the Gomukhasana, let's try the Vaisasana on the opposite side. Now, my right knee is in the bottom, left knee is on the top. Balancing asanas. What a wonderful practice. Then you incorporate Gomukhasana. Gomukhasana, look at here actually, is a relaxation response. Might hold the lower part of the body, relax. And in fact, actually, in a yoga practice, the yoga practice is called a holistic. It is not a reductionist. Reductionist means I'm going to relax my left knee will be relaxed. That's not the way yoga practice works. Yoga practice is when I'm relaxing my lower part of the body, my upper part of the body also get relaxed. I'm also in a parasympathetic tone. Look at my face. I have a saliva in my mouth. This saliva in your mouth is a sign of your parasympathetic activation. Now for the Gomukhasana, we turn around to go by step, so you'll be able to see what you're talking about. Here, my left knee is down, the right knee is in the top. My right knee is in the top, my right hand goes up. Left hand comes in the middle. Let me just hold the elbow. So put my left hand in the middle. My right hand will come down. I hook it. Literally, I handshake each other. I'm still talking, I'm breathing, I'm singing. It's a total relaxation of your whole body, mind, and your spirit. Stillness. In Sanskrit, health is called swastha. Shastha. Sha means self. Stha means stillness. Stillness of your body, mind, and spirit. Opposite side. Now comes your right knee is down, left knee is in the top. See, one need to stay in this posture a little longer. Longer means between 5 to 10 breaths, on which you will feel that the relaxation response is setting in. Now my left knee is in the top, my left hand goes high up. The right hand comes in the middle and holding the elbow. I'll put the right hand in the middle. Left hand will come down. I'll touch it. I will hook it. Essentially, I'll be handshaking each other. For a regular practice, you will feel your one side is easier than the other side. Those are wonderful practices we're doing. In fact, we'll continue the therapy for metabolic syndrome because it's going to cover. Maybe we'll do in the next couple of Saturdays. So hands on the side, feet in the front. This is called a Dandasana. Take your right foot next to your left thigh. Take your left hand, put it outside your right knee. Right hand goes to the back. Left hand comes front side. Will be touching your knee. Look straight. Breathe in and out. 4 to 5 times, and slowly turn your body away from you, and you will see this is a very nice way to test your breath. If you go too far, you'll catch in your breath. When you feel like you're catching your breath, back off. Stay in a posture where you will be able to breathe essentially effortlessly. Spinal twist or Bakrasana. Wonderful practice. Left foot next to your right thigh. Right arm comes outside your left knee. Left hand goes to the back. Right hand comes and touches your right knee. Spine straight. Look straight. Exhalation longer than inhalation. Slowly turn your body as far as you can turn without any effort in your breath. Balancing practices. Ardha Matsya Andrayanasana. Another spinal twist. Be comfortable. This is such a comforting asana. If you keep doing it, even you'll do it sitting in a chair, your feet will go high up without knowing. For me, I'm doing it, and opposite one will set in even without my consciousness. It becomes totally almost unconscious. It happens so many times when you're presenting. You have a suit tie on for a medical conference, sitting in a chair. Suddenly see feet is high up in a chair. I'm sitting in a cross-legged posture in a chair. This is my right foot, goes a little outside your left knee. Right knee, the left arm goes outside your right knee. The right hand goes to the back. Left arm slowly comes down, touches your knee, touches your feet, goes all the way down. Turn your body and 5 breaths. The moment you do it, you will feel that imbalance in your physical body affects your breath. So the whole effect of asana practice, whole effect of pranayama practice, you can feel within yourself, and you also can see it in your health tracker. Opposite side. Same way. Now the left foot outside your right knee. Left knee comes outside, right arm goes outside your left knee, left hand goes to the back, right hand comes down, touches your knee, slowly it will go, touches your right foot. Turn your body to the left. 5 to 10 breaths, breathing out longer than breathing in. So, every time you practice your balancing asanas, balancing pranayamas, and also a sense of coming down, quieting down your mind, which is our meditation. Meditation is the medication. 2 words, a root word is saying medera, Latin, or medicos, the health or the health provider. If you look at the spelling, the difference is meditation has a T, medication has a C. So T is for your transformation, C is for your choice. We'll continue these practices. Primarily we'll do practices for a daily routine, which is maintaining our health, which is called a strong digestion, easy elimination, and good night's sleep. For the strong digestion, we have 5 asanas. Proper elimination with 5 asanas called Shankha Praksalan. Proper digestion, proper elimination, we have pranayamas, we have kriyas, Kapalbhati pranayama, Bajra pranayam, Uddiyani Bandh, abdominal lock, Agnisar kriya, Nauli kriya, Kapalbhati as a kriya, Kapalbhati as a pranayama. So let's finish today with a sense of profound meditative practice. Remember, meditation is a state of mind when your chattering of your mind comes down, called Chitta Vritti Nirodha. Chitta is your mind, Vritti is a chattering, Nirodha is a controlling. We have thousands and thousands of thought process in our mind we are generating. Mind is the content of our five senses. Most of our thought process are in the past. Another one is in the future. Very little we have in the present, but we need to live in present. Past is a history. Future is going to be mystery. Today is called present. What is present is a gift. Take it. In a meditative practice, you enter in between your thought process, which is called a gap. Slowly and slowly you learn how to increase this gap. So you still have the thought process, but the chattering of the thought process goes away slowly and slowly. You never get rid of your thought process. All of your thought process gets into a file and a folder. This will be a practice which initially thought to be almost impossible. Alternate nostril breathing without closing your nostril, in silence, with your eyes closed, keeping your spine straight. This is called accessing your subtle body. So I changed my foot again because I want to activate both sides. In a yoga practice, we access our subtle body. We have three bodies. Gross body is connected to our body, subtle body connects to our mind, and causal body connects to our spirit. Subtle body is the body which I have left somewhere as a mind. Like for example, we used to be teaching in a Sattvic space yoga studio. I'm here in Bethesda, Maryland. I can clearly see myself in a Sattvic space in Portsmouth, Virginia. I'm parking my car. I'm entering the front entrance of a Sattvic space. The owner, Maury Cook, receiving me. I'm going, sitting down on my mat. All the people in front of me and started the practice. Clearly see. Same way, if you can see my eyes are closed, I can touch tip of my nose, I can head off my head, touch my left shoulder, right great toe. I mean, anything you can do so the practice will happen. Let's try. Close your eyes, touch your index finger and thumb. We'll be doing this in silence. I'll guide you initially. Then in the silence, we'll do it a few times. At home, you do it for a little longer time. Spine is straight. Hand touching in a meditation mudra. Index finger and thumb, palm facing high up. Bring your awareness into the left nostril. Breathe out through your left nostril. Left nostril is supplied by the right brain. The right brain is intuitive, right brain is female, right brain is parasympathetic, right brain is cooling. Left nostril breathing is called Chandranari, moon energy, parasympathetic. We start in the left nostril. In your practice, you breathe out first. Breathe in through your left nostril. Breathe out through your right nostril. Right nostril is controlled by left brain. Left brain is analytical, it is made, it is sympathetic, it is heating. Right nostril breathing is called your Suranari, sun energy, heating, sympathetic. So just breathe out through right nostril and breathe in through your right nostril. Breathe out through your left nostril. I can clearly see with my eyes closed in my subtle body. The air is going in through my left nostril. Air is coming out through the right nostril. Just close your eyes. In the silence, let's do alternate nostril breathing without closing our nostril in a meditative practice. I will give you a cue when we finish this practice. can continue practicing at home for a longer period of time. Slowly bring your hands in front of your heart chakra, Anahata chakra. Touch your little finger and thumb, separate your middle finger, index finger and ring finger. Padma Mudra. Lotus Mudra, it connects our body, mind and spirit. Heart is the site of the soul. It is the brain-heart connection which keeps us awake, alert and alive. Padma Mudra, Lotus Mudra is in your heart. Practice of yoga brings our health, our wellness, physical health, mental health, spiritual health. Physical wellness, mental wellness, spiritual wellness. Exercise activating sympathetic tone is a partially hypoxic practice. It increases your strength and stamina, but also when you have an oversympathetic drive, body creates a homeostasis with a parasympathetic activation. So you do see the effect of lowering of your pulse rate, lowering of your blood pressure after exercise. Yoga practice is primarily a parasympathetic activation, creating health and wellness through a phenomena of relaxation response, activation of parasympathetic tone. Slowly bring your hands in front of your heart chakra and finish with a kind of palming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove the glasses, take both the hands like a cup, put it over your eyes like a cup, let the eyes take all the heat from your hand. The heat in the eye relaxes your ciliary muscles. Ciliary muscles controls the convexity of your lenses. Relaxation increases the convexity of your lens, helps you do the reading without a reading glass. Slowly massage your forehead. All the muscles here are attached to the skin. Relaxation of the muscles will remove all the frowning of your forehead. Massage your whole face. All the wrinkles, all the lines slowly will go away. It will look like the face is literally glowing. Take your hands behind your ear, massage the earlobe, behind the ear, in front of the ear, even inside the external auditory canal. Here is your branch of your vagus nerve, called auricular branch of the vagus nerve. It will activate your vagus nerve, parasympathetic activation. Take your hand, massage the carotid sinuses on both sides of the neck. Massage of the carotid sinus will relax and come down your cardiovascular system and nervous system. Take the hands to the back, to the tubercle. Massage the muscles in the back, which are your trapezius muscle and sternocleidomastoid muscle. It's a wonderful experience, relaxation response, and if you want to measure your blood sugar will be down, your heart rate will be down. When I was touching this, in this meditative state, I can feel now, I can feel my capillary pulsation. I cannot feel too much of this even sensation. This goes away in a meditative phase. Thank you again for joining this wonderful session of yoga therapy for metabolic syndrome. We will continue this session in the next few Saturdays. Maybe next Saturday we'll do more practices for health and healing, like asanas for strong digestion, asanas for proper elimination, and a good night's sleep. Then we'll follow with a practice of your meditation, practice of pranayama and the meditation. And again, it is a daily practice for daily routine and a 1 hour of practice. How to do it? You do these asanas, you alternate the asanas, you pick and choose the asanas for relaxation, but definitely do a set of pranayamas, which we'll be doing the pranayama practice, set of pranayamas and the meditation, 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation. Thank you again for joining. We'll come next Saturday for another session, then we'll go accordingly. And if I'm in town, we'll be always coming virtually in this setup in a Facebook Live. See you next Saturday.